Assalamu alaikum and a very warm welcome. I am Umama Muzammil, Deputy General Manager, Medical Affairs and Pharmacy Services. On behalf of PharmEvo, I would like to thank and welcome you all to our third Beyond the Pill session, which is designed to give you a global perspective of how the pharmacists are combating with the pandemic of coronavirus. Unlike many other public services and businesses, community pharmacies continue to stay open throughout the COVID-19 pandemic to deliver essential counseling, information, and medicine supplies to patient and local community. With a significant increase in demand for medicines, coupled with a change in public behavior, such as panic buying, over-the-counter painkillers in response to the lockdown, has put up tremendous pressure on pharmacy teams. This catastrophe brought forward a challenging role for our pharmacists, and we all emerged to be the most trusted healthcare provider. This session today is with our expert pharmacists who will share their experiences of how they coped with the unprecedented situation and how this pandemic is going to change the future of community pharmacy. I would like to introduce the session moderator, Dr. Farooq Malik, who is a pharmacist by profession and has done his PhD in pharmacoepidemiology and pharmacovigilance. He is currently working as a Chief Consulting Officer, Cinch of France. So over to you, Farooq.
Right. Thank you very much. Hello and assalamu alaikum everyone to this third live session Beyond the Pills. Following the first two sessions in the same series where we invited pharmacists from Canada, UK, France, Colombia, US and Sri Lanka, we are now on to our third program where we will have another set of pharmacists from the US, Australia and 3 pharmacists from Pakistan. Now, a recorded version of this session will be available on Facebook as soon as we finish here. We look forward to the questions from all our listeners. So you feel free to type your questions in the comment section of this live feed. Now, as Umama said, this pandemic, which started in December 2019, is already into its 5th month now. And, healthcare systems around the world are being tested quite intensely in different ways. The frontline workers, be it physicians, nurses, pharmacists, and all the others, have been fighting on the front lines in containing and management of the patients that are affected by this pandemic. Now, talking about pharmacists who have contributed, improving public health in a variety of different ways. And we discussed this in the first couple of sessions, how pharmacists have contributed within and outside hospital retail pharmacy. Today, as Umama just said, that we will be focusing primarily on community pharmacists, and we will try and understand how our colleagues working in different parts of the world would like to share their thoughts on what they're going through at the moment, their different challenges, and how do they see the community pharmacy would come out of it once this pandemic kind of slows down. We've seen, evidence published in the literature when there was, in the last pandemic of 2019, H1N1, even the student pharmacists played a very critical role, in kind of facilitating the patients, giving them education and the resources regarding that pandemic. Now, I will start, and open the discussion and request our first speaker. So each speaker of us today will have 5 to 7 minutes to speak on their chosen topic. And then we'll have discussion and question and answers in the end. So we'll start with the US first. Now, as you all know, US being affected like the most in the whole world, more than 1.5 million cases and over 90,000 deaths until today. And more interestingly, within US, New York is one of the states that has been more affected with 23.5% 5% of those cases and over 31% of the total US deaths because of this COVID-19. So I would request Mr. Salman, who is the CEO of True Care Pharmacy and is a veteran pharmacist since 1983. He holds an MBA, a master's in pharmaceutical sciences, is currently based in New York. So I would like to request him to open the session with his talk, please.
Right, Assalamu alaikum. As you know, my name is Salman Baidar. I work for True Care Pharmacy. I do own it, but I still say that I work for True Care. It's a community pharmacy, independent store. It's based in Pomona, New York, which is in Rockland County. Rockland County is I believe is the second largest area that was hit with this COVID-19 after New York City. So I have prepared all these slides for you guys, but I rather share the personal experience that went with it. As we know that, when it comes to COVID-19, only two medical fields are mentioned all the time, the doctors and the nurses. But I believe the pharmacists made a big deal and, they're on the forefront of this fight with COVID. And community pharmacy is already, at the risk. So what do we do? When this happened, the first thing that we noticed was how do we protect our staff? That was my main concern, because without having a staff, it's going to be hard for us to operate the pharmacy. So keeping a safe environment for your staff and also for your patient, that was our main goal. And at the same time, giving the patient their medicine, providing them the necessary means to obtain that, that was our main thing. So how do we do this? We were communicating with our patient. We started doing that beginning of March. We started seeing patients that were coming down with this thing. So we started contacting them, and at the same time, what we did is we right away, we arranged for a meeting with our staff so we could discuss how we're going to behave in this environment. And the first thing was the cleaning initiative that we started. Every 2 hours, we decided that we're going to clean the counters and anything that comes in contact with the patient. We mounted the sneeze guard because we realized this is an airborne disease. How do we protect our staff? While at the same time, how do we protect the patient on the other side of the counter? So we mounted these temporary sneeze guards. There's a plan to install permanent guards now, which is going to happen soon. Now, while all this was going on, there was a tremendous inflow of people that were coming into the pharmacy, or trying to come into the pharmacy. How do we stop that? So we stationed a technician outside the pharmacy and allowed only one person at a time to enter. And once they were done, then we'd allow the other person to go in. This was was done to ensure that there's a minimum contact with these people. And there's a less, chance of transmission. At the same time, we were trying to utilize the technology to work for our interest. We started taking credit cards over the phone, so there's less, contact with the patient or the people who are purchasing things. And then we also removed all the items from the counter. So then there's a less chance of transmission for this thing. At the same time, what we did is we were trying to educate our patients. We used the phone, we used social media, we used our web page to spread the word that what we're going to do for you is we're going to bring you the medicine. Instead of you coming to the pharmacy, there are two ways you can do it. Either you can come to the curbside delivery, you come to the parking lot, and then we'll deliver to you, or we can bring it to you to your doorstep. Also, this time was a time when we decided how are we going to cut down the number of trips for the patient to the pharmacy. So we looked into doing 90-day supply, which means 3 months. And also we looked into the patient was, the profile, we can somehow cut down their trips by synchronizing their medication. So how do we make it work? We're staying in touch with COVID-19 updates. We're we're still sticking to our strict regimen of cleaning the counters. It's a team effort between the doctors, the pharmacists, and the nurses, and caregivers to ensure that the patient are receiving their meds. We're constantly in touch with them to ensure that they have their prescriptions, refills. Mind you that the doctor's office has been closed down, closed their doors for the patient. So it became very hard in the beginning to reach out to the doctors. But we found different ways, and that's how we keep in touch with the doctors to obtain their prescriptions. Now, what happens when we open up? It's such a fluid situation that every day there's something new happening. So you have to keep adjusting to the new and new normal, you would say. And that's what we're trying to do. Any questions at this point?
Right. Thank you very much, Samantha, for your comprehensive overview on how you guys are dealing with this pandemic in the state of New York. Now, I'll move on to our next speaker, Mr. Mahboob Ahmed, who's a registered pharmacist who did his pharmacy from the University of Punjab, and then did his MBA from Oklahoma City University, USA. He's a CEO of one of the largest chain of pharmacy group by the name of Clinics Group of Pharmacies. And he would be talking about the identification and management of the potential cases of COVID-19 and how community pharmacy has a possible role in mass screening of COVID-19. So over to you, Mahboob sir.
Thank you, Dr. Farah Malik and Team Pharmibo for inviting me, and especially Ms. Umaima, and organizing this wonderful webinar. And keeping in view the time constraint, I will briefly talk about the role of community pharmacists in identification and management of potential cases of COVID-19 with mass screening. Respected participants, as you know, that community pharmacies in areas where this pandemic is or it is not are the first point of contact with the patient systems, with the health systems for two reasons. Number one, you know that there are increased health-related concerns, and number two, people they need more information and reliable advice. And in Pakistan and all around the world, as you have witnessed, that hospitals, OPDs were closed, private hospitals were not working, doctors were not in their offices. So naturally, patients looked for the advice that they came to us, and we have witnessed in surge of patients coming to us for the consultation. And therefore, we realized that the community pharmacists, our community pharmacists, should have sufficient technical and scientific knowledge about COVID-19, and in particular on the symptoms, incubation period, and mode of transmission of the virus, so that they can guide the community in a real professional manner. And at the same time, the community pharmacist, I am of the view that should also be skilled. This knowledge is not enough. They should have the skills to implement that knowledge. So given this context, we trained our pharmacists. As I talked earlier, we have more than 75 pharmacists working in our organization. So we made some videos, some literature, we sent them, and we trained them because they had to play two roles. Number one, they have to guide the community, and number two, they have to protect themselves and the staff working in our pharmacies. As I mentioned earlier, we have more than 1,400 employees in our organization. So, and they were on the forefront. They were on the front line, and we're dealing with, we don't know, the patient is coming here, are they infected or not infected? So we have to protect ourselves and protect our customers and our environment. So in this context, let's talk about identification of COVID-19 patients and role of pharmacist. It's not a secret now that 80%, more than 80% of the patients of COVID-19, they do not show any symptoms, as you know, and they are, you can call them mild cases. And then there are few percentage who have severe disease. They show some, symptoms, but the symptoms are not severe enough. In the third category, which we call it critical, and they develop some very serious symptoms like pain and pressure in chest. And in those conditions, we have, as I said, we developed some protocol for the pharmacist, that how we can advise our patients in case if the patient comes with symptoms, we advise our pharmacist that just tell the patients to go to near any health facility and should have tested themselves. And if they have a mild case, if there are mild cases with no symptoms, as you say, they are asymptomatic, but they can spread this virus. Many studies have shown that if the patients are, even the patients are asymptomatic, they have the same viral load as have the patient with the symptoms. So we advise them isolation, and we advise our pharmacists that please do not physically examine them and keep distance, and advise them to wear mask and isolate themselves in their houses. And at the same time, even if the symptoms, if the patient come up with symptoms, you know, the symptoms of COVID-19, there are many confusion with the common cold and flu. So you cannot judge that the patient is suffering from COVID-19 or he's just having a common cold or flu. So unless we test it. So there are, because we are on the forefront, so we have advised our pharmacists and trained them that they should have an insight into the testing procedures and what tests are available. So there are different tests available to determine whether the patient have COVID-19 or not. And the first test, we test for the viruses. If the body has virus, so there are three methods which are applied. And number one is the reverse transcription, polymerase chain reaction. It's simply called PCR, and this is very accurate. If you have a very small amount of virus in your body, it can detect, and it can amplify that, and then with fluorescence method, you can detect the virus in your body. The second method is same. This is PCR, but this is called isothermal method. In isothermal method, we do not use heat for the denaturization of RNA, but we use an enzyme for the denaturization, but the remaining procedure is the same. So that's why it is called isothermal procedure. And the third one, both of these tests, they need about 2 to 4 hours and need a lab. But as far as the third test is concerned, that's called antigen test. It's very simple. It's not as sensitive as PCR is, but this antigen test is very quick and can be done in 15 minutes only. So in the conditions where you have constraints on your budgets and kits, you can perform antigen test to evaluate whether the patient has COVID-19 or not. And the other test, which is called serological test, it's not detection for the detection of viruses, but it can detect antibodies. Antibodies detection is, I think, more important in CFR, case fatality rates, because you hear that the mortality rate, or CFR, is more than 2% or 2.5%. But that rate is dependent on the patients which are coming to hospitals. But in a study in Germany, when they tested the community, they found that more than 16% of patients they were tested, they had antibodies against the COVID-19. So that dramatically reduces the mortality rate, the CFRs, case fatality rates, from 2% to 0.3%. So serological testing is, I think, very important. And at the same time, I am of the view that if you do some serological testing and the patient have developed immunity, you can use those persons on the front line because they are immune. They are less prone to the disease. So you can use their plasma for the treatment of patient. And number two, you can use those patients which have we are healthier now. So you can use them on the forefront because they will not be contracting the disease again. So serological testing is, I think, important in this regard. Another testing technique, as you know, not many kits are available everywhere. So governments have tried to pooling the test. So the pooling which were they doing for, firstly they were doing that was a two-step pooling technique, and now an Indian Institute of Technology and with the collaboration with Harvard University and Harvard Medical School, they have formed a 28 members team. They have developed a new technique that's called tapestry. Tapestry is basically a technique for weaving the cloth. If you see carpets and ladies' cloth, they use a technique that's called tapestry. They use different threads to make designs on the cloth or carpets. So they named it tapestry. In this technique, what they do is that they take a sample. This is single step. The other pooling techniques they're using is a single step technique, a two steps technique, but tapestry is single step. So you can do more testing with less resources and in less time also. And at the end, I would like to also say what we advise our pharmacists for the management of potential cases. We advise them that please have test for the COVID-19, and especially serological testing. We also recommend that. And at the same time, as you have heard the word smart lockdown. So in smart lockdown, government must train some people who can trace contacts. If any person who had this COVID-19 disease, he has contacted some other persons. So you must develop some tracers who can develop their contacts. Some of the methods, like they're very common, to use masks, and definitely we are all waiting for the vaccine, and or otherwise the Sweden model, so that we can go towards herd immunity. Thank you very much. I think it's my time is up now. Thank you very much.
Thank you very much, Mehboob Saab, for your comprehensive overview of what are the different testing mechanisms that you guys are adopting or recommending to your patients. Now, what if flu and COVID-19 overlap? This is a huge question for the upcoming next season for the Northern Hemisphere. Yeah? But down south, Australian authorities are preparing for a possible overlap between the COVID-19 and their flu season. To talk more about it, we have Adil Pervez Khan, who's a registered pharmacist in New South Wales, Australia, and currently works as pharmacist in charge at Terry White Chenmart, Plumpton, New South Wales, Australia. And he will talk us through managing the regular flu season versus the COVID-19 in the Australian context, so to speak, because their flu season is already, kind of starting. So over to you, Adi.
Okay. Once again, thank you, Farooq, for the opportunity. And as the other two speakers have discussed about the role of a pharmacist, so pretty much we have to work it on the same way to protect ourselves, to make ourselves to be protected first, so that we can ensure all our patients, all our clients, all our visitors should be protected with going against any kind of a contacts. So as Farooq has already introduced myself, so I've been working in Australia for past almost 10 years. And out of 10 years, I worked like 9 years as a community pharmacist and 1 year as a trainee pharmacist in the hospital. So with the vast experience of the community pharmacy here, I have got lots of cases coming across here, which of the flu seasons, as it is started in the April usually. And with the flu season, as we know that everywhere we have got the same kind of symptoms that we come across. So one of the common symptoms that we always have is like a runny nose or coughing, so sore throat, which is much similar, which is now simply coinciding with the COVID-19. So presentation-wise, they both have the respiratory disease presentations. And most of the time, COVID-19 has an edge on that one, that it may be asymptomatic in that case. But usually one of the signature coughing that they have come across here in Australia is like a dry cough in the COVID-19, which is persistent for days and days, as compared to the chesty cough, which may come up after 2-3 days of the flu interaction, or when you had the flu and you ended up with the chesty cough or nasal discharge. Again, the both viruses has the transmission by contact or by the droplets and the vomitives. And data-wise, 80% of the, as I told you, the COVID-19 is asymptomatic or very mild, like a flu-like symptom. 15% of them are severe, which is mainly come up with the elderly population or those who are immunocompromised. 5%, again, those who are like a palliative care patients or those who have been contacted in the immunocompromised stage. So they require the ventilation. So this fraction has been considered as the very, very high risk in COVID-19 as compared to the flu. So if you go back to the influenza now, so influenza affected population includes like the children, pregnant women, elderly, those with the underlying chronic medical conditions. So these four populations, I want you to just remember these ones, because these are the ones which has been always considered as the more vulnerable towards the flu in every population, in everywhere, not only in Australia, not only in the Southern Hemisphere, across the globe. But for the COVID-19, our current understanding is that older age is the most targeted and the most affected, or the most, as compared, if I talk about particularly in Australia, is the more fatalities has been found in the elderly people over 65 or the 70 years and over. Secondly, the numbers of flu-like, obviously because of the COVID-19, the things have been eclipsed under the COVID-19, but we should not forget that flu itself has the mortality rate of at least 290,000 to 650,000 people per annum across the globe, which is really a big number. So we don't have to take the flu itself just very lightly. Now, I just directly jump onto the community pharmacist role that we are performing in this context and across the globe. Just sharing with your experience of mine here with the 2020 flu season in Australia. So we have to, as discussed by the previous speakers, that we have to just make sure that because of the COVID-19, we have to be more cautious about any kind of a context. So any kind of a context means that you just have to try unnecessary touching, unnecessary use of the stuff. And for the pharmacist perspective, that one good thing that I want to share, that here in Australia, they have strictly allowed, like in the US pharmacies, we have to just listen that they have allowed certain numbers of the people should stay in the pharmacy so that they can maintain the social distancing. So that is one of the major advantage that can prevent you from the flu as well, not only from the suspected COVID-19. And secondly, with this precautions, they have introduced just a brief questionnaire at the entrance of the pharmacies that I think in Pakistan, that if you're using it already, then it's really good. If you're not, then you can implement it depending on your available workforce. That just as you enter in the pharmacy, they just quickly ask you the few questions that have you been to the overseas in the last 14 days? Have you contacted or you know anyone who has come across with any kind of a flu or the COVID-like symptom? Or you have come across with any coughing. So these are the ones that can give you a bit of the protection for you and for your staff and for the rest of the population. So again, as we know that when we have to be coughing, we have to just just protect ourselves using the elbow technique, which I just want to share that it is a sunnah of Prophet Muhammad, peace be upon him, as well, so that we can not transmitting any of the possible bacteria or the viruses to anywhere else. There are currently no licensed vaccines for the COVID-19, as we all know that, but luckily we have got a treatment for the vaccines and the antivirals, which is already into the practice, already into the market. While the influenza vaccine is not effective against the COVID-19, that is should be understood by the not only by us, but also to the population, that we have to educate the population here all the time that flu vaccine has got its own significance, but don't expect that it can cover you from the COVID-19 and you start misbehaving against all the social restrictions you have been implemented on. So it is highly recommended that you take the vaccines just to protect yourself from the influenza. Here in Australia, and I'm pretty much sure in the US and Europe as well, pharmacists are now licensed to administer the vaccines on the spot. So there's a growing opportunity for the pharmacies to make a feather in your cap, just to you can have the administration capacity of the flu shots. And beside the flu shots, we are allowed to do the DTP, diphtheria vaccines, and the MMR vaccines as well. So that can not only give you a professional value, but also gives you a financial aspect of the pharmacies in terms of the revenue wise. So then I just briefly explain you the strains that has been come up with the flu vaccine, because every year the flu vaccines has been re-editioned depending on the inoculation of the influenza A and influenza B, 2 strains of each, that makes them the 4 strains. So this year also we have got influenza A, the 2 strains, H1N1 and H3N2, and similarly influenza B, the B Washington and the B Phuket. Similarly, I just want to, in the last part, I just want to quickly go through that we have to be very much careful, and we have to be very much proactive while educating the people about the use of their self-hygiene, because everything starts with the first step with your self-cleanliness and hygiene. Social distancing, which is, I just told you that it is the best way that we have curbed this problem here. And just in the state of New South Wales, which is the largest state of Australia, where I'm here right now, and the capital city is Sydney. And the last 2 days, we have done almost, like the government has done extensively 15,000 tests of the COVID-19, and just the 1 case has been reported yesterday and 1 case has been reported today. So I think that's a big crackdown just because of the lockdown and the smart lockdown that they have done in the last almost 2 months. That has ensured that our numbers are now less than 5 per day that has been come up. Secondly, lastly, elderly people and the chronic population, which is more prone to the flus, which may be life-threatening for them, they always have to be encouraged. If the pharmacist can encourage them, that they can speak to the doctor. If they can just have the affordability scenario, then it is then awesome, just to protect them from the flu-like symptom that can cause them severe health hazards. Otherwise, if you have got a long-standing flu condition, like here, if there's no COVID-19, then for the treatment of flu only, not for COVID-19, I repeat, this is Tamiflu, which is oseltamivir, 75 milligram for adult, for 5 days, one twice a day, but that's only on the prescription only. And in the lastly, I just want to share with you that with my personal experience, because by discussing with the patients all the time, I just always try to encourage and push the herbal supplements just to protect yourself and to increase your immunity as the season starts. Vitamin C, we all know about it, but I must recommend echinacea and andrographics extracts and the olive leaf extract. They can not only give you the promising sign against the flu, but overall your respiratory health to be ensured. So that's it from my part. And I once again thanks Farooq for this opportunity, for keeping me on board in this 3rd symposium. Thank you.
Thank you very much, Adil, explaining the Australian case. And as I said earlier, the rest of the world probably should pick up all the possible, positives from the flu and the COVID-19 handling of Australia at the moment, and use them in their upcoming flu season. Now I'll move on to our next speaker, Syed Zaad Ali Hashmi, who's a senior manager pharmacy at a new chain of pharmacies called Mary Pharmacy. Now, Zaad actually will try and sum up many of the other points raised by our speakers, and he will be talking about the community pharmacist and its role in the public health emergencies, learning from the experiences of the past and how we're dealing at the moment, and the way forward. So I'll request Zaad to take the floor, please.
Thank you very much, Dr. Farooq and pharmacist and Ms. Umaima Muzammil for inviting me here with such a richly experienced pharmacist. It's immensely a pleasure for me to present a brief of a presentation regarding COVID-19 and the preparedness of community pharmacy or the pharmacist in such emergency situations. We all know that community pharmacy has a big role in managing the conditions that double as risk factors for pandemic diseases or in any emergency condition. First of all, the COVID-19 and situation like those eventually made us realize that how vulnerable we are with such natural calamities. and what crisis may reshape in such lasting days in our society. But moment of crisis eventually leads to opportunity, and we think that this time the community pharmacy, the role of community pharmacy has extended, and the pharmacists are being our frontline heroes and performing their duties regarding reducing the burden of shifting the patients for the eligible patients, because they are most accessible to the community. So that's why they are playing their vital role. So there is a brief presentation regarding the role of pharmacists and their preparation, which may lead to any emergency or crisis situation. The community pharmacy, as you all know, are working with the frontline workers, with doctors, with nursing, addressing disease outbreaks, pandemics, in prevention of the spread of the disease. Their contribution in the efficient management has been outlined by all of the organizations, including WHO and International Pharmaceutical Federation. The role actually includes some of the major roles which a pharmacist is playing throughout the world in any part when this pandemic started and whenever there is an opportunity. First of all, they are providing the services while working 24/7 of telemedicine or drug information center services. You all know that in current scenario where there's a lockdown throughout more than 100 plus countries, and people are not be able to go to the outpatient clinics, they are providing them counseling, the drug information, drug monitoring, dose monitoring, the interactions, or such information which may benefit them and for their chronic ailments. The second and the most important thing is the supply of medicines. You all know that in the areas like us or in third world countries or second world, when such pandemic or crisis situation comes, the role of pharmacists actually extend, because the people got such type of hype that we want to have all the stock of medicines that can eventually lead to shortage of medicines. So for ensuring the adequate storage and supply of appropriate stocks of relevant medicines, the PPEs, the protective personal equipment, the masks, the sanitizers, even there is a time come in the world where the sanitizers become short. So there is a role of community pharmacy and the pharmacists who started preparing sanitizers here in Pakistan and all over the world in their compounding pharmacies. So this was about the stable supply of medicines that a pharmacist must ensure regarding his preparation in the emergency situation. Involved in US and UK, the pharmacists are being involved in testings of COVID-19, and this is something that has to be a new curve, a new learning dimension for the pharmacists. Their role has been extended towards testing as well, because the people can access the pharmacies very easily as compared to any other health facility. In vaccination too, there are around more than 10 articles where you can search on the internet regarding the role of pharmacists in vaccination of COVID-19, because the vaccine is in trial phase, and if inshallah it will become successful, then it's the role of pharmacy or the pharmacist individual to actually create or administer that vaccine. As trainer, as a counselor, it is the prime responsibility of all the pharmacists working in the community worldwide to actually ensure the patient regarding either it's social distancing, either it's about purchase of medicine, either it's about what's going on regarding the medical field and what are the symptoms, what are the precautions that you have to take. In worldwide, dry services are being offered by pharmacists along with nurses. Home delivery is one of the main factors that a pharmacy or a community pharmacy should acquire while dealing in emergencies for the e-commerce facility, and the drug information is the last, as the people are in need of this. Now, we will talk about briefly one by one. Telemedicine, you all know that pharmacists and the pharmacies are involved in this emergency situation for online reviewing of prescription, counseling, interventions, and to direct patient that he has to go for a tele-appointment of a doctor if the minor ailments does not subside. And drug information centers, which actually are the best resource in this pandemic situations. Supply of medicine, as I earlier stated, it's the responsibility of pharmacists to ensure that the adequate supply of medicines, including hypertension, asthma, diabetes and all others should be there. And with the medicines like in this emergency situation, antivirals, anti-allergics, sanitizers, masks, that the disinfectant, that should be enough in the pharmacy so that patient can take benefit from this. Chronic ailment medicines should be in enough stock, and also to ensure and to guide the patient that it's not necessary to have the stocks. Here in Pakistan, the patient are asking about 6 months or 1 year stock that can eventually lead to pharmacy and medicine shortage in year or in the months to come. That has to be addressed by the pharmacists as well. Sorry. The third, the main rule regarding emergency preparation of a pharmacist is testing. The testing, because of the accessibility, the pharmacist or the pharmacy can test a large number of individuals. And we are seeing that currently in Wuhan city, they are saying that whole city and the whole population has to be tested for the corona for the next in 3 days. So the community pharmacy has to play a role in testing too. The vaccination, as I stated earlier, the pharmacist has to play a key role in COVID-19 or any other immunization where the patient can access and can come directly to the pharmacy. Little bit regarding the situation in Pakistan, what pharmacies are being facing. First of all, this pandemic lead to a hype that the medicine like hydroxychloroquine is a precautionary measure or should be taken as a precaution. It's become short here. Similarly, in case of chloroquine, which the people believe after various press conferences that it has been found effective in the treatment. But here is the role of a community pharmacist to ensure them that what steps, what medicines, what tests, what symptoms he or she has to take regarding as a frontline workers. As a trainer, first of all, it's our duty to ensure that spite of all the medicines, either it's Remdesivir, either it's Olistomivir or any other medicine, the practicing and educating the patients and the people regarding their personal environmental hygiene, the use of PPEs, the use of masks even. We have met a large number of shortage here regarding the mask, and the people were using the cloth masks, which were not effective in any case of any virus or bacterial infection. So it has to be addressed at some level through the pharmacy regarding the test phase, what are the symptoms that has to be taken. We at the pharmacies here in Karachi, Pakistan, actually directing patients so that you have to go with these symptoms to the doctor, or you have to go to conduct the test because the symptoms are not good in such scenario, and it should be addressed. While people or the public would not be able to have some sort of advice or suggestion from anyone. Dry services in a community pharmacy has to be done quite immensely nowadays and being used worldwide regarding the testing and counseling and asking the patient regarding the symptoms, because you all know that we have limited number of beds, limited number of occupancy in hospitals and communities. So if a filter can come out through a pharmacy, which can actually guide that what and are the symptoms and which patients are eligible to go to the next stage, that could be quite beneficial for them as well. Home delivery, as I first said, that in such emergency cases, all the community pharmacies should encourage to have a system, an e-com system regarding through any website or through any mobile application or through any toll-free number, so that the deliveries and the medicines can be reached out there to the patients. Concluding all of the above fact that regarding of the preparation of a pharmacy or pharmacist in case of emergency, we have a role of informing, advising, educating, maintaining hygiene and screening of suspected cases. And for pharmacists, it has to be quite important to be ready for the emergency preparedness and response arrangements at community level, public-private partnership, and real-world data, so that we can accommodate throughout in the community. Thank you very much. Over to you, Dr. Farooq.
Right. Thank you very much, Zad, for sharing your comprehensive presentation on how things have been in Pakistan and in general, and how community pharmacy has been playing a role in handling the public emergencies, in different ways. Now, We'll move on to the questions quickly. We have a few. There's one for Mehboob Saab, which says, are you currently testing your staff members for any of the tests that you mentioned? Because you have a chain of about 40 pharmacies across the province of Punjab, I guess. So are you screening any of your staff members for COVID-19 at the moment? You have to unmute.
Actually, we are not screening, but the government is screening our staff to evaluate. So far, they have had some tests of our staff, but all were negatives. So we are not, because there is a shortage of test kits. So I think it's not mandatory for everybody to go there and have a test. So I think we should reserve those kits for the people who deserve those. I think, but government is testing our staff and other stores which are open. That's what they are doing. We are not doing it.
Right. Thank you. We have another question, which would be to Salman Saab and in the US and Adil in Australia. It's about the shortages of medicines. So as Azad briefly mentioned, so there were a few shortages after certain treatments were promoted and propagated at different levels. So have you seen any major shortages of medicines, let alone not for the COVID-19, but for any other ailments you would like to share?
I'll go first. So far, the only one that we saw majorly was the HCQ, the hydroxychloroquine. It's been in short supply. There are a couple others, antihypertensive, that's been in short supply for a long time. Other than that, I think we did pretty good so far. But again, that's only short term. You don't know what's going to happen down the road, because most of these pharmaceutical companies here, they actually, obviously they build up their stock, but once it's depleted, that's actually down the road, maybe in 3 to 6 months, we'll see more shortages coming through. That's what I would say.
Right. Same question to Adil.
Okay, thank you, Farooq. Yes, it's a very good question. And as Salman Saab has just expressed, similar kind of shortages we have experienced since after the panic buying, when it is started initially 3 months back in the supermarkets, like the toilet tissues kind of a thing. But later on, the pharmacies are only affected, if you talk about particularly in Australia, is about the puffers, especially the Ventolin puffers. They have been only because of they have been overstocked by because of the panic and the fear buying. But later on, the government has intervened, as maybe most of you people have know that we have got a public health system, which is just like a replica of the NHS in England. So they have just intervened and they have strictly limit the sale of the medications just for 1 month, and especially with the puffers to be supplied only for 1 per person. And even interestingly, the puffers we only supply as in pharmacist only. Like if somebody came in without a prescription, we are allowed to hand him over. But then most of the pharmacies, they have restricted only for the prescription, only for the meanwhile. But now the things are stable. The only thing that we are experiencing is the few antihypertensives, which are coming from imported from either from raw material from India or from China. So there is a minor shortages there. But again, the companies are striving their best to just overcome the shortages. Thank you.
Right. Another question for you two, and then there's a question for Mehboob Saab after that. Have you got, what's the most asked question regarding the COVID-19 at your outlets? Salman Saab first, and then Adil again.
Do in future.
Oh,
sorry. So most patients, most people are worried what's coming down the road. How are we going to be in the future? And nobody knows the answer to that. I guess people are really worried. If this is the new normal, social distancing, putting mask on, a lot of people are frustrated that we see here because of that. And plus the fear that came that, like I was telling you before, so many people lost either their close friends, family members. We have seen families completely wiped out because of this. Generations in some cases, 2 or 3. So it's been very deadly on this side. So that's what they're worried about, that what's going to happen. Is it going to go away? Is going to be there? Also, initially we got questions on HCQ or chloroquine. I just wanted to point that out to you guys, that talking to the infectious disease doctors and pulmonologists, they all recommended that should be reserved for in-hospital use, and they advise us not to dispense it to retail patients. I just wanted to add that.
Adil, if you can respond to that.
Yes, the most, as per my presentation as well, that the flu shots, because we have started giving the flu shots, and because of the COVID-19 this year, we have got a record number, like not only my pharmacy, but across Australia, the record number of flu shots have been dispensed, and most of even the companies are vigilant that they are giving the flu shots. So most of the people, they are having an idea that maybe the flu shots will going to give them extra immunity against the COVID-19. So we have to explain them, first of all, that it is nothing to do with the COVID-19, but it will gonna improve your overall health. And I must share this thing that surprisingly this year, I haven't seen much of the flu cases as well. Because of the social distancing, our cold and flu sales have been declining, but which is a good thing in a other way around, that at least the health perspective of the whole of the society is being more cautious, and people are much more, because of the prevention. That's a blessing in disguise from the COVID-19, that the flu cases are down. But again, what they have said earlier, that people are again concerned, and when the lockdowns will be finished, we are at the brink of easing the restrictions. But again, the life is not going to be as normal as before. So that's what the people are expecting it, especially those who are planning to go overseas, or those who are expecting some overseas visitors. But again, our numbers are pretty good as compared to the rest of the world, thank God. So that's what we are expecting, that our restrictions will be much ease with a few of the long-term, the restrictions, especially the travel ban, and especially the cruise ships only.
Right. There's a question for Mahbub Saab. Did your facilities compound anything, products like hand sanitizers or something out of your facilities?
No, we are not. We are buying hand sanitizers from different manufacturers, but we are not dispensing it.
Right. Okay. Now we have a question which actually kind of applies to all of you. So all of you can answer like briefly, shortly, in like 10 seconds max. What's your primary source of information? When all that information going around with all the, the treatments, prophylaxis, herd immunity, what is okay and what is not okay. And I read something yesterday, in a discussion group, which says it's more of a confused 19 rather than COVID-19, because, there's so much information out there. So, all 4 of you, if you could just briefly say, what's your primary source of information in designing any local strategies that you may build, develop, and apply in your facilities? So start with Salman Saab, Mahbub, Adil, and then Zad. Salman Saab, you have to unmute.
So our main source of information comes from like our local pharmacy organizations, APHA, National Community Pharmacy Association, also through some of the other associations that we are affiliated with. Also talking to the local doctors, infectious disease, especially pulmonologists. Those are mainly our source of information.
We are not relying on information given by newspaper or news channels. We are gathering our information from CDCs like CDC of USA and China, and any other authorized source, and doctors, etc. But we are not relying on news channels and newspapers. And I think that's what we should do.
Right, thank you. Adil, your take on this, please.
Yes, as Salman Saab has discussed about all the professional lines, like the doctors and the paramedic staff, the nurses, and the relevant organizations. And in Australia, mainly the state health department, which is just like the government representative body, like New South Wales Health Departments, Queensland Health Department, and the Federal Health Department. So they are instructing what should be the next line of action, how you should have to continue. And they have got a very good mechanism of communication, so that any case has been reported that goes straight into their knowledge. So they have updated data on the every moment, in the real time. So we have got all the strategies coming from them straight away.
Zad, if you could say something about this.
Yes, definitely. We have WHO guidelines which can be followed and can be accessed very easily any part of the world. We have CDC guidelines as mentioned by Mahboob. But locally, we have some good information and authentic news at Ministry of Health and Control and Command Center too, regarding the international and the local residential cases. And for all the guidelines that are actually being shown up there, so we can use them and access them too.
Right. Thank you very much for all your answers and for all your inputs and your sharing of all the experiences that you've had at your workplaces. Now, to conclude the session, community pharmacist continues to be the most trusted and the accessible resource for the public during any public health emergency. And we here in France kind of experienced that. We had a 55-day lockdown, and a lot of the GPs were closed as well. So the community pharmacist was one trusted and accessible source at all times. Now, the genesis of COVID-19 pandemic, it occurred less than 5 months ago. And as you all have shared, that our knowledge is still changing daily. What was relevant a week before may not be relevant today. We have had a series of different trial results leading the conversation and directing the conversation in a certain way every morning as we wake up. And the community pharmacist does have a key role as drug information experts in all this time. So they give the patients an extra advantage of someone that can explain them what the situation is at the moment. But yes, there are certain things that we may not have the answers for as well. So by serving as an essential source to the healthcare system itself, to all the providers, patients, as I said, and the general public, pharmacists are very essential in mitigating the adverse consequences of this current pandemic. Let me just quickly have a look if there are any leftover questions. Yes, one last question. It says, is PPE, the personal protective equipment, provides cover for those with facial hairs? What does the hydroxychloroquine drug is used to, or was it used in SARS-CoV-19 response in sick patients? So any of you who've had the experience of that drug being used, in the SARS pandemic, I mean, do you think it had any role in the earlier pandemic, Salman Saab? you could say something about this, please. You have to unmute. I think we cannot hear him properly. Adil, you had any experience of HCQ being used earlier?
Not as such, because with the SARS, unfortunately, I don't come across. But as hydroxychloroquine, it was just came into when it was under trial. But later on, I never come across with any of the demand as such here. And PPEs, because again, there is in my experience, there are two school of thoughts. One is saying like a general one that you have to put the PPEs all the time, no matter where we are working. But other school of thought that I've just come across with one of the doctor here, who is also a public health professional in the University of New South Wales, and he's saying that whenever you are in a close vicinity with a certain number of people, then you need to wear the mask and everything. But better safe than sorry. You have to, if you use the protections with the facial hairs as well, it can be better, because it's only the one who has already got infected, that has to, for him to be protected from the rest of the people, and vice versa. So mainly from your mouth and from your nose, that's the only point of contact. That's what I've been told.
Right.
I want to add, Dr. Farooq, one comment regarding the facial hairs protection, that the face shield can be used, and we are using it here in the pharmacies for our staff, so that the whole face can be protected along with the mask, with the face shield.
Right. Mehboob Saab, do you have anything to add to that?
As far as I think hydroxychloroquine is concerned, many doctors were of the view, and they had a center here in Lahore who experimented hydroxychloroquine, and I had a notice from India that one of their province, they advised their doctors to use hydroxychloroquine as prophylaxis against COVID-19. But now that they have once for all decided that this is not effective against COVID-19. I think that's it for it.
Right. Now, thank you very much for answering all the questions. I once again want to thank the organizers, PharmEvo, for this special initiative, bringing pharmacists from all around the world to share their perspectives, and how they're dealing with this ongoing pandemic. I want to share, especially to all our speakers today, especially Salman Saab, who woke up really early in the morning, to Adil in the US, Mehboob Saab in Lahore, and Zad in Karachi. And most importantly, to all our listeners, who have asked all these different questions, which help us kind of understand the subject much better. We hope to bring you another session, with a similar esteemed panel, and we wish you a very good day. Thank you. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you very much.
Thank you, and have a nice day.